The trend for colon cancer is going down, it's going down like this for the United States, whereas for us, the trend for colon cancer is going the opposite way.
According to Island Surgical Center's Dr. Ricardo Eusebio, many 50-year-olds and older fear colonoscopies, which are key to screening for colon cancer. Dr. Eusebio assures patients that it's an easy outpatient procedure. You're put to sleep, wake up 30 minutes later, and you're back to work the next day.
The reason why it's an excellent screening tool is because, and it's pretty specific for colon cancer, is that colon cancer begins small, starts as a polyp. It's called a polyp. It's a little growth in the lining of the intestine. It starts that way and then grows exponentially with time. Most colon cancers grow very slowly, so that if you can get the colon cancer at the stage where it is a polyp and remove the polyp, then you prevented the colon cancer from developing and progressing and becoming larger.
If the polyp is allowed to grow, it can become an obstruction in the intestine, resulting in colon cancer.
So by the time patients come to you with symptoms of obstruction, with bleeding, those kinds of things, then the cancer is pretty big. And the cancer has, in most instances, spread to beyond the confines of the colon, beyond the confines of the wall of the intestine.
Dr. Eusebio says colon cancer doesn't discriminate. Healthy or not, anyone can get it, which is why he recommends males and females, 50 years of age and older, to undergo screening.
Once you start having symptoms, it's a little bit late, but if you're having problems with your bowels, if there's been a change in your bowel habits, like for example, if normally you go every day and then now you're not going every day, you're going every few days. If there's a change in your bowel habits, if you have blood in your stool, if you notice blood in your stool, if you feel a lump in your belly, if you've had unexplained weight loss, if you go to your doctor and they check your stool and they find that there's blood in your stool, those are situations where you really need to do an investigation.
Once diagnosed with colon cancer, surgery is key.
You need to remove the colon cancer itself, and then depending upon the cell type, depending upon where it is, the colon, the rectum, you may need to have chemotherapy and radiation therapy. How fatal is it? If it has spread to other organs, it's pretty much fatal.
Health Check is presented by
Island Cancer Center.